Hello everyone, my name is Jay. I'm one of the expert OET teachers here at E2 Language. What I'm going to do in this lesson is give you a super quick overview of the OET test. I'm going to explain to you all of the OET subtests, and I'm actually going to show them to you so you can see what they look like. So if you're preparing for this test the night before the test, which unfortunately a lot of you do, well, at least this will give you some sort of preparation. Or if you're just unfamiliar with OET and you want to work out whether it's the right test for you, this video is the right video for you, okay? First thing I want you to do though is subscribe to this YouTube channel because we release very, very high quality content describing the OET test and how you can pass it as soon as possible. Okay, so the OET test consists of 8 subtests: writing, reading A, reading B, reading C, listening A, listening B, listening C, and speaking. That's how it's divided up. Let's talk about the writing subtest first. And this, by the way, is the most challenging subtest. This is the one that most candidates fail, okay? So you need to be very aware of how this works. And one thing I highly recommend you do before you go and take the OET test, which is relatively expensive and infrequent compared to other tests. It's a great test, by the way, if you're a medical professional, but I highly recommend you get some writing feedback. Someone who is a trained OET expert, like the teachers at E2 Language, who can very quickly look at your writing, deliver it back to you, and tell you what you're doing right and wrong, okay? So do think about that. It's a service that we offer at E2 Language. Okay, so in the writing subtest, you get 5 minutes reading time, 40 minutes writing time. This is what it looks like on test day. This is an example test booklet. You open it up and there are a set of case notes. The case notes are profession specific. So nurses get nursing case notes, doctors get medical case note, dentists get dentistry case notes, etc. At the bottom of the case notes, you'll see what's called the task, the writing task. And you can think about this writing task kind of like an essay question prompt. You know, when you have to write an essay, if you write off topic, you're going to lose marks, right? Maybe your essay question would be something about education or taxation. And if you write off topic, you lose marks. It's similar in OET. It's not telling you what to write per se, because the case notes sort of almost give you the content. It's telling you which information to choose and how to organize that information. Of course, then it's up to you to write it into grammatically correct sentences and coherent paragraphs, etc. But this is what the task does. It basically tells you who you're writing to and why, okay? So that's what you'll see on test day. This is the place or the piece of paper that you have to write your letter on, and you'll get 2 of these, which is plenty of space to write your letter. Okay, and you also get a piece of paper for notes, and I highly recommend that you make a little plan before you begin writing your letter. You spend a couple of minutes after the reading time writing your plan. Just for your interest, during the 5 minutes reading time, you cannot use a pen or pencil. Okay, it's a good opportunity to read through the case notes, think through them, and make a little plan in your head about which ones you're going to choose, which ones are relevant, which ones are irrelevant, and maybe how you're going to structure up your letter, okay? Okay, this is an example or a model letter. You can see here right at the top there's the Ms. Samantha Bruin, and then the address of the recipient, the date regarding the patient and the age, dear Ms. Bruin. You have the introductory sentence or paragraph. This is an interesting one because it actually consists of one big paragraph. Now, this is a little bit unusual. Typically, you will have sort of 2 or 3 or 4 paragraphs. Then you will have the request, followed by the sign-off, and that's it. One of the questions we get all the time here is, how do I structure my letter? And the answer to that is it depends. It depends on the task. It depends who you're writing to and why you're writing to them and whether that person you're writing to knows the patient or not, okay? There is no set template that you can use. And if your OET teacher tells you that you must have medical history followed by social history, please find a different school because that person does not know what they're talking about. Really, the only thing that is set here is the address, the sort of those little bits like the address and the date, etc. That's always going to be the same. There's going to be an introductory sentence or paragraph that outlines the main purpose and the reason for writing. Then it's just up to the case notes and dependent on the task. And then at the end, you're going to have a request. That's about as much structure as you can memorize before test day. On test day, remain flexible, write according to that task. Cool. Okay, these weird sort of things you're looking at here are called the criteria. Now, this is what the assessors, the OET assessors, the people who are marking your writing are looking at while they mark your writing. So you're graded on purpose, content, conciseness and clarity, genre and style, organization and layout, and language. This is why it's so critical to get some expert feedback before you go and take the OET test. And I don't mean expert feedback from a friend or even expert feedback from a non-expert OET teacher. This is quite complicated stuff. The person who is going to give you feedback really needs to understand in detail how the OET assessors mark your writing. And we do, okay? So if you do want some writing feedback, submit it through the E2 language platform. We'll give you some comprehensive and meaningful feedback that will help you to pass. Cool. Okay, let's talk about reading part A. This subtest goes for 15 minutes, okay? It's an extremely quick part of the test. And on test day, that 15 minutes is going to feel like 5 minutes. This is what it looks like. So you open up your booklet there. You're going to see texts. Right at the top there, you can see fractures, dislocations, and sprains. So these texts, text A, text B, text C, and text D are all about fractures, dislocations, and sprains. They're all about that single topic. Okay, and they're all slightly different. You can see text A there has some sort of definitions. You can see in text B that it's about management of simple fractures. Text C is about drug therapy, and text D is about how to apply some plaster, for example. So they're all different but related to the single theme. That's fine. So following that, you also have a separate question paper, right? And on the question paper, you have 20 questions. Questions 1 to 7 ask you in which text can you find information about, for example, number 1, procedures for delivering pain. And what you need to do is you need to think back, well, not think back because you've got both, right? You've got the text booklet with the 4 texts and you've got the question and it's saying in which text, A, B, C, or D, can you find information about delivering pain relief, for example? And you need to quickly look across and go, okay, that's text C, and you just write C. So that's the first set of questions. It's important that you start with these questions because what they do is familiarize you with the 4 texts, okay? As you're going through and going da, 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 you're starting to sort of understand and get a bit of an idea of each of those texts. By the way, we offer really good methods for all of the subtests, but I think particularly for reading part A, E2 language has an excellent methodology, a step-by-step process to make sure that you're getting the right answer, okay? So that's the first part, it's the matching questions. And then you can see questions 8 to 14 there. They are short answer questions. For example, number 8, right at the bottom says, what should be used to elevate a patient's fractured leg? And you select a word or a phrase from one of the texts. Questions 15 to 20 are gap fill or sentence completion. So again, you need to select a word or a short phrase from one of the texts to complete that sentence accurately. Okay, reading part B and reading part C are done together, okay? So they are not separated. I should mention that after reading part A is finished, after the 15 minutes, someone will come around and collect your reading part A, okay? Then you'll be given reading part B and C, and that's timed separately, 45 minutes to complete both of them. So you have to manage your time as you go through them. Let's have a look at them. So you open up your question paper for reading part B and C. Here's an example reading part B question. You can see that it's a multiple choice question. There are 3 answer options, and below it is a short text. The texts that you see in reading part B are short, and they are workplace texts. So for example, you might see something like this from an instruction manual, or maybe an email, or I don't know, something that you would see in your workplace. And you're going to get a question about it. This question is a sentence completion question, or you might get a question that asks a direct question with a question mark. Okay, and you'll get 6 of these on test day. For part C, it's different. For part C, what you get is a long text. I think these are up to 700 words or something like that, divided into paragraphs. And it's about a specific topic, for example, sleep deprivation. And following this large text, you can see how long it is, for example, you get 7 questions. Again, multiple choice. This time there are 4 answer options. The good thing about this part of the test is it directs you to which paragraph you need to read in order to find the right answer. For example, question 7 says, in the first paragraph. Question 8 says, what do we learn about sleep in the second paragraph? So it's actually guiding you through that long text, which is very helpful. And keep in mind that the questions are sequential as well. So, it's the first question 7 is at the top and you're moving your way down. It's not over there yet though. So what happens next is you go through to question 14, then you get another one. This one's about ADHD, for example, and it's the same thing, 700 plus words. Again, 7 questions, 4 answer options, and you make your way through it. Okay, if you need practice materials, and I don't mean just any old practice materials, I mean good quality practice materials. One of the things that we see all the time is poor quality material. Stuff that is not actually going to help you before test day because the questions are too hard, too easy, completely not related to the test at all. It's very difficult to write good quality OET questions, especially like the writing subtest, for example, let alone reading part C. So just be careful where you get your practice materials. There are 2 sources I recommend, the official OET website or e2language.com. Check out that website. It contains fantastic high quality material, methods lessons, live classes, tutorials, writing feedback, a mock test with feedback, for example, heaps of stuff that will help you to pass your test. Whoopsie, live classes, tutorials, practice tests, writing feedback. Okay, let's think about the listening section here. You don't really need to worry about time now because these are just timed according to the length of the audio. You don't really need to manage your own time here. You just need to manage your way through each of these subtests. So this is what the listening subtest question paper looks like. You open it up and you've got listening part A. And what you're looking at here is a set of case notes that has gaps. For example, you can see patient Ray Sands, 18 months ago, back injury sustained, lifting, blah, blah, blah. And what you're going to hear is a consultation between a medical professional, it may be a doctor or a physio or a nurse or something like that, talking to a patient, okay? And they're going to be having a conversation. Obviously, the medical professional is going to be asking questions, but there's a bit of back and forth. All of the answers for these gaps come from the patient. The patient will be responding and saying the answers. What you need to do is take what the patient says, that single word or short phrase, directly from what they say and put it in that gap. So the job is to follow in sequence through the conversation and down through the case notes. That's the sort of secret there. And you should be using those headings like patient or symptoms or whatever it is to guide you through, and there will be sort of paraphrasing, synonyms used. Again, there's a real method to this, to doing it properly, a step-by-step method. And if you want that method, check out the website. Cool, so that's how it works. You'll get 2 of these though, so 2 consultations in listening part A. Okay, listening part B looks like this. It looks very similar to reading part B, except this time you'll be, instead of reading a short extract, you'll be listening to a short extract. It can be a monologue, that is one person speaking, or a dialogue with 2 people speaking. Okay, so for example, with 25, you read the context statement. It says you hear a nurse briefing her colleague about a patient. So you're going to hear 2 people speaking, and then you see the question, what does she warn her colleague about? Okay, you'll be listening very carefully for the answer to that, and you'll be selecting A, B, or C. Just bear in mind that these audios move quite quickly, and so it is a matter of really knowing what's happening well before test day. Hopefully you're not watching this video the night before the test. If you are, good luck. But if you are unsuccessful, do come back, because I really do think that a lot of success comes from just being familiar with how these questions work. Of course, there's English language, which is another thing I'll talk to you at the end about at the end. Okay, so that's listening part B. You'll get 6 of those. Then you get listening part C, and this I think is the most challenging subtest. Okay, it's like reading part C, except this time it's an audio, and you're going to hear 2 different types. You'll hear a monologue or a speech, one person speaking, and again, you have to manage your way through the questions, listening for sort of signposting, or when it switches from question 31 to 32 to 33, for example. There's a lot of sort of reading and listening at the same time. Excuse me. Or you might get a second type of audio, which would be a dialogue, 2 people, an interviewer and an interviewee, which in many ways is easier because when the interviewer asks a question, you know you're switching from 31 to 32 to 33, for example. But this is tough. This really does test your ability to understand what's being said, not be distracted by keywords that might be in the answer options but which aren't correct. Really is about listening for meaning. It also is about rapidly reading to understand what the question's asking before it starts, for example. You do get 90 seconds before the audio begins to quickly read through, to sort of familiarize yourself with each of the questions that you're about to see. So you'll make your way through listening part C. And again, like reading part C, you're going to get 2 of them, as I mentioned. And you make your way through that. And that is the end of the listening test, which brings you to the speaking test. In the speaking test, you will have to do 2 5-minute role plays, okay? So don't think of this as an English language speaking test. Think of this as a clinical situation where you're speaking to a patient, okay? You may want to pay attention to the criteria or watch the criteria videos or how you're scored. Again, they're on e2language.com, where we explain in detail how you're scored. But really, it's a speaking test, but just as much as a speaking test, it's also a listening test, because you're also graded on your ability to actively listen and respond appropriately to what the patient says. So it's not just about you going blah, 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 blah. It's about you paying attention to the patient, responding to the patient, etc. Cool. Now, how do you do that? Okay, so what you're given before the role play is one of these role play cards, okay? And so this role play card gives you a few things. It gives you the setting, it gives you a scenario, and it gives you some tasks. And you have to sort of work with the scenario and through the tasks while you're speaking to the patient, excuse me, who also has their own role play. Bear in mind that the person you're speaking to on test day is not an examiner. The person you're speaking to on test day is just like an actor, an interlocutor. They're just there to perform the role play, and that's it. So that will help you with your anxiety if you are a bit nervous before test day. The other thing that will help you with your anxiety before or on test day, again, is paying attention to the other person, not paying attention to yourself and worrying about your performance. You're worrying about communicating with them, communication. That's key. Cool. So you get 2 or 3 minutes to prepare with this role play, and then you get 5 minutes to perform the role play. It's going to elicit all sorts of language from you. Then you get another one. So again, a different one, a different setting, a different scenario, different tasks, 2 to 3 minutes to prepare for this one, 5 minutes to do the role play, and that's that. Cool. So that's a very quick overview of what is quite a complicated English language test. 95% of this test is English language skills. Okay? If you don't have grammar, vocabulary, or pronunciation, you're going to struggle, right? It doesn't matter how much test prep you do. However, if you are ready, if you do feel confident with your English skills, check out e2language.com. Do one of our test prep courses. It will certainly bring you up to speed, get you ready for your test. It's a little bit of money up front, but think about it as an investment, because failing this test is expensive and time-consuming and stressful. Now, if you do lack fundamental English skills, if you're concerned about your vocabulary, your pronunciation, your grammar, even just your general English, check out this website. It's e2school.com. It's a really good way to prepare for OET. You can do the OET test prep and E2 school, E2 language and E2 school at the same time. So you're doing test prep and skill building together. It's a great idea. This one, this e2school.com, is very inexpensive. It's $9 per course per month. So $9, that's like the cost of a lunch or less, maybe less. So yeah, check that out. Anyway, I hope you've now got a good overview of OET, how it works, what's going to happen on test day, what it looks like, what you need to do. And I hope you do prepare for this test, because many people don't. And yeah, you want to get it right the first time around, or maybe the second time. Cool. Thanks very much. My name is Jay. I will see you soon.